Welcome to the BioWhisperer channel. Our topic today is on an overview of liquid biopsy.
What is a biopsy? A biopsy is a sample of tissue taken from the body in order to examine it more closely. Doctors should recommend a biopsy when an initial test such as imaging or during physical examination suggests an area of tissue in the body isn't normal. So what is liquid biopsy? Tissue biopsies, which have for the past decade been the standard procedure for diagnosing cancer, can be invasive, risky, and painful for the patients. Moreover, not every patient would be suitable for tissue biopsy because of tumors' locations, multiple metastasis, or other health conditions. Gaining traction as an alternative procedure in the recent years is the usage of liquid biopsy. Liquid biopsy testing as an alternative is less invasive, faster, easily repeated compared to the standard tissue biopsy procedure. It is also more useful when a tumor's location makes tissue biopsy unfeasible. There are a few types including aspiration biopsy, skin biopsy, needle biopsy, bone and/or bone marrow biopsy, imaging-guided biopsies such as CT-guided or ultrasound-guided processes. Moreover, there are also organ-specific biopsies such as liver, prostate and kidney biopsy. In such scenarios, biopsy is carried out often using a needle injected into the tissue via the skin to capture a sample of the tissue for examination. For surgical biopsy, which could either be open or laparoscopic surgery, may be necessary to obtain a biopsy of hard-to-reach tissue. Depending on the patient's condition, either a piece of tissue or the whole lump of tissue may be removed. How do medical practitioners perform liquid biopsy? Liquid biopsy is the innovative solution to cancer detection and treatment. While liquid biopsies are revolutionizing oncology, they are not yet ready to entirely replace their competition, solid tissue biopsies. Liquid biopsies, which are usually performed on blood, aim to analyze DNA from whole circulating tumor cells, known as CTCs, or cell-free DNA, known as cfDNA, from tumors. Until recently, oncologists had at their disposal only two Food and Drug Administration, known as FDA, approved liquid biopsy tests, and they targeted single genes. In fact, most tests specifically target a type of cell-free DNA called circulating tumor DNA, known as ctDNA. This ctDNA mostly comes from cells from within the developing tumor mass. More recently, the FDA has also approved new tests that use next-generation sequencing, known as NGS, to target many genes in advanced cancer patients. It has clear advantage to screen for mutations as well as to profile solid tumors. The approved tests help to better position oncological understanding of cancers towards precision medicine and against targeted therapeutics. Moreover, tumors with high mutational burden might also respond to immunotherapy. As for the pros and cons, analytical interpretations from liquid biopsy are typically quicker than those for tissue biopsy. The reason being tissue biopsy needs lab work. Some of the tests also require real-time monitoring. Liquid biopsy is better adapted to tracking, including repeating to assess if the therapy is working. For instance, the levels of tumor cells or cfDNA can be assessed to determine if they are disappearing from the blood. Oncologists also could use the new liquid biopsy tests to monitor patients for emerging new mutations that could be treated with the current therapy or another drug. Challenges, however, exist as cfDNA testing can identify alterations that are unrelated to a lesion of interest. Were given the fact that tumors are heterogeneous, it will be impossible to know whether a liquid biopsy test analyzes DNA that represents a fraction of the tumor mutations. Tissue biopsies are affected by several components of origin, such as tumor location, tissue amount available, and accessibility for surgical removal. The road ahead experts pointed to potential future uses for the newest breed of liquid biopsies. At this point in time, all eyes are on the day when liquid biopsy can be employed to spot cancer early, and it is projected that liquid biopsy will be part of routine care one day in monitoring treatment and assess molecular residual disease.
Thank you for watching this video. If you like this video, please smash the like button and subscribe to this channel for future updates.